explain exactly what a bucket handle tear looks like. So I drew this picture: left knee, femur, tibia, lateral meniscus cross section, medial meniscus cross section, ACL, PCL for reference, trochlear groove. I did not include the patella. Here is the femur. So if we look at the medial meniscus and we look at it from above, a tear would look like this from above. Longitudinal tear, basically from posterior to anterior. In this particular picture, I do not show it displaced. It is still in normal position, but you still see the gap. Once this becomes displaced, this portion right here flips, and it looks like this. So this is a non-displaced longitudinal tear, but once it starts to flip back and forth, that's called a bucket handle tear. There is the bucket handle tear. Why is it called a bucket handle tear? Because it actually looks like the handle of a 5-gallon bucket, and it actually can go back and forth like a bucket handle. When it's in a reduced position, it may not cause that much pain. Patients are actually able to function with some pain, but once it is displaced like this, the knee will lock. So just to demonstrate what I'm talking about, this would be a non-displaced bucket handle or non-displaced tear, which, like I said, some patients can function pretty well with just a tear, but once it does this, now you have this bucket handle portion, which would lock the knee. So if we were to draw this portion right over here, basically there would be a big piece of meniscus over here. Actually, it usually gets caught inside the notch. So I didn't really quite draw this very well, but there would be a portion that would go like this, and it would be caught, and this piece basically would be over there. So that's a bucket handle tear. I hope this explains it the best right here. This piece moves back and forth, and the goal of surgery, therefore, is to repair this tear in a way that it seals itself up on its own and is no longer unstable. So what's done is sutures are placed. Prior to suturing, this gap is roughened up, bleeding is created, sutures are placed and tightened, and the gap is compressed. That is the goal with bucket handle medial meniscus repair. So we will now go back to the video. Thank you.